I'm Dr. Angela McKaye, chiropractor and naturopathic physician, and it is Testimonial Tuesday. We're talking about SIBO this week, and we did already talk about a case with a young woman who had SIBO previously and how she was successful treating SIBO after a bout of food poisoning. But I want to talk to you about a case now that was just a little bit more complicated. So I had a woman in her mid-40s who came in and she has low thyroid, so hypothyroidism. And because of hypothyroidism, it slows down your metabolism a little bit. So that migrating motor complex that we talked about, that doesn't move as quickly. So digestion can be a little bit slower when you have hypothyroidism. So that lets food sit in the small intestine longer, which makes a perfect environment for little critters to find food and hang out and have a pretty cushy lifestyle if that's not remedied. This person also had some higher histamine levels. So she had MCAS, which is mast cell activation syndrome, and mast cells live in your skin, in your respiratory tract, and in your GI tract. They're kind of all over the place, but they're in high concentrations in those tissues. So their job is to hang on to histamine unless there's an invader, and then they'll just go throw a lot of histamine at it. And histamine also makes things leaky so that repair cells can get to the area of injury and start cleaning up whatever foreign invader has gotten in there or whatever mess there is to take care of. So in addition, she had that as well, which meant that she had some leaky gut and some other things going on. For her, we did 1 round of antibiotics with rifaximin. That is an antibiotic that stays local to the GI tract. So it goes into your small intestine and it hangs out there and does its job there without having to necessarily go systemically. So you don't end up with a lot of the side effects that you can get with other antibiotics of systemic side effects. So that is a really great antibiotic. There's been lots of research on it to show that it's very effective at treating SIBO, but it is still relatively new and expensive and can be difficult to get insurance to cover. So for that reason, we only did 1 round of antibiotic with her, and we did 1 month of herbal antibiotics. So that was a combination of herbs, and it includes herbs like berberine, which has some crossover with some Chinese herbs. So there can be some really great Chinese formulas that can help with this as well. But we use naturopathic herbs in her case. So we use berberine, oil of oregano, some garlic compounds that were high potency garlic, as well as some prokinetics. And prokinetics are things to help the digestive tract move a little bit more smoothly, a little bit more regularly, and support motility through the GI tract so that food's not hanging around in the small intestine for too long, as well as changing her diet. Now, in her case, she did a low FODMAP diet. That is not the only diet for SIBO. There are different diets available that can be really helpful, and different things work for different people. She did really well with the low FODMAP diet, but there's also a specific carbohydrate diet. There's also paleo that I've had some people do really well with, or ketogenic diet that I've had some people do well with, and there are other diets out there. So just know that you don't have to be restricted to one. What worked for somebody else may not be what works for you. In her case, we ended up doing a 2nd round of antibiotics. She had been sick for like 17 years with this, and so she had this going on for a long time. So it wasn't reasonable to expect magically 1 round of antibiotics after 17 years was going to fix everything. So we ended up incorporating more food after the 2nd round of antibiotics, and then so she did an additional month of antibiotics, and then slowly started introducing food again, and then started having more symptoms. So she found that when she sort of fell off the wagon with her diet, symptoms came back. So then we had to do a 3rd round of treatment, and we did rifaximin again and another round of herbal antibiotics, and then slowly came off of that and started reintroducing food again. And she found then after that she was able to expand her diet quite a bit and eat most things. But if somebody had a birthday party and she got a little too much cake or went a little overboard, she would have symptoms, and then she would just revert back to the low FODMAP diet for a day or 2, and that would be enough to keep her back on track. So she was able to expand things and have a mostly normal diet most of the time. And during the course of the 2 years that I treated her, she only had 1 or 2 relapses during that time that were really short-lived, that she either took care of herself by just reverting back to the low FODMAP diet or doing a couple weeks of the herbal antibiotics and getting back on track that way with very minimal intervention and very minimal symptoms. So it didn't ever blow up, so to speak, no pun intended. In her particular case, due to the underlying factors with the hypothyroidism and the hypermobility syndrome, she has a situation where she kind of has to keep an eye on it the rest of her life, but she's in a place now where she's able to manage it, able to eat what she wants. She doesn't have to stay strict on any particular diet. She's tasked to be aware of which things she can have, how much she can have. So it's not that she can't eat birthday cake, it's just she has to be careful about how much of it she consumes, and just be able to live with a little bit of moderation. And she also has the tools that she needs at this point to regulate that herself should she start to have symptoms again. again. She's one of those 2/3 of people who may have repeat recurrences versus the 1/3 who get treated once and then they're totally fine. But she's completely happy with her level of symptoms and ability to be in control of her symptoms now, that she doesn't have any periods of feeling absolutely miserable anymore. She's super happy not to have the bloating, the gas, the nausea every single day. So for her, that's worked out great, and she's doing fantastically now, probably 3 years out since the first time I saw her. So just know that it is possible to feel better if you find a practitioner who knows what they're talking about with SIBO, and can help guide you the way to get there. If you have any questions, let me know, and I'll be happy to talk to you in the next video.